All right, let's talk about why it's not okay for providers to mess with your pumps, especially when they don't communicate it with you. Let me give you a quick story of something that happened to me years and years ago. So it was 7 a.m. I was in the middle of getting report from the night shift nurse. I was the day shift nurse coming on, and one of the providers rounded in our ICU, went into my patient's room who was intubated, sedated, turned off this patient's sedation completely, didn't tell me or the night shift nurse, and just walked away. So all of a sudden, this patient's vent's alarming, and the night shift nurse and I are like, well, what the heck's going on? We go in there to assess the situation and realize the sedation's completely turned off. So when we realize this, we go ahead and turn the sedation back on. At the same time, the patient ends up self-extubating themselves. This was a very young and wild patient that, like, if you know, you know, the sedation needs to be handled appropriately to do a sedation vacation, not just completely shut off because we knew this patient would be wild. But the provider went in, just turned it off, walked away, didn't say anything. And we turn the sedation back on at the same time the patient self-extubates. So then we go ahead and turn the sedation off completely right as the sedation kicks in. And then we have to start manually bagging the patient because it took away this patient's respiratory drive completely. It took a couple minutes. The patient came back to, all was well. However, this could have been prevented. So first and foremost, I'm all about sedation vacations. I'm all about weaning medications that patients don't need, but it has to be done at a time that is safe for that nurse and for the patient. If I have a patient that maybe I need to take to MRI or CT and I'm working on that and a provider comes in and shuts off the sedation on my other patient, that's not a good time for me to try and wake that patient up and get them extubated safely. I'll do it. I promise I'll do it. I just need to do it at a time that is safe for me and for the patient. Another thing is when a provider titrates your medications for you, who's charting it? You're only supposed to chart things that you do personally as a nurse. So if that medication gets titrated by somebody else and they don't chart it, also, I've seen time and time again, not all providers know how to correctly titrate the drips or work the pumps. And so things get programmed incorrectly. Maybe they do too high of a dose, too low of a dose, and it's just not safe for the patient. So ultimately, it's a safety issue. I'm all about weaning people. I'm all about getting their sedatives off when appropriate, weaning their pressors, medications that they don't need. But it's got to be done at a time that is safe for, one, me, myself, my license, but more importantly, the patient.